What impact does politics have on socialist health care? Imagine a world where health care is seen as a right, not a privilege. The way governments handle this idea can change everything about how people access medical services. Politics is the key player in shaping socialist healthcare systems. It influences how much money is allocated, what rules are set, and how care is delivered. When a country adopts socialism in healthcare, it usually means the government takes charge of funding and managing services. This is because socialist principles focus on fairness and universal access. Political decisions decide whether health care is a public good or a market commodity. In socialist systems, policies are made to ensure everyone gets the care they need without paying at the time of service. This often involves high taxes to fund hospitals, clinics, and health programs. Governments may create single-payer systems where one public agency handles most of the funding. This reduces administrative costs and cuts out profit motives, making health care more affordable for all. Politics also shapes how health care providers work. Governments can set prices for medicines and services, negotiate with doctors and hospitals, and set quality standards. Public ownership of hospitals and clinics is common, which helps keep costs down and aligns care with public health goals. But political shifts can cause changes. When a new government comes in, priorities might shift, leading to cuts or expansions in health programs. This can impact access and quality of care. Bureaucracy is another political factor. Centralized control can sometimes slow down decision-making or create inefficiencies. Politicians must balance the need for oversight with the flexibility health providers need to innovate. Funding levels depend on political will. If a government prioritizes health care, it may increase taxes or reallocate budgets to improve services. If not, services could face cuts or delays. Politics also influences public attitudes. When leaders promote health as a right, it encourages citizens to support policies that expand access. Conversely, if political debates focus on cost-cutting or privatization, public trust can weaken. This can lead to protests or demands for policy changes. In practice, political choices determine how well socialist health care systems meet their goals. They decide whether health care is truly universal and equitable, or if disparities remain. Expanding mental health services or addressing social factors like housing and nutrition depends on political will. These decisions shape the overall effectiveness and fairness of health care. So, in the end, politics is the engine behind how socialist health care functions. It sets the rules, funds, and priorities that decide whether health care is a universal right or a privilege. The strength of a socialist health system depends on sustained political support committed to fairness and public welfare.